Talking about when somebody has scars maybe on either side, the skin's not moving back and forth, maybe a distal radius fracture where everything is pulling in like this. So what's interesting is when it pulls in like that, it crosses the two nerve pathways right here, and if the skin doesn't glide back and forth, it really irritates right there, really irritates through here. So if we can lift up the sections or the quadrants, and especially between the radial styloid and the ulnar styloid, that skin becomes very inherent. So since we're working with skin, we're going to do thin cuts, very thin like this, and we can put her on a stretch. So go into a stretch frame, and we can just take it and put it directly in over the middle like this. We'll see if we can spread them a little bit. Doesn't have to spread all the way. Put that like that so it looks wrinkly and cute. Okay, like this. And then we're going to do here and here. So it's really good for ECU surgeries because that tendon and that scar tissue right here, or even TFCCs, gets so adherent on that bone, and a lot of the pain comes from that. So get a little bit of deviation. Thank you to my wonderful model. And then we'll hold that down. You can lift up if you wanted to lift up more. It's this one. Then we'll go to the other side. And do this. We need to get it again. And it's quite nice and light. I did that one jinky. Can't use that one. I'll have to edit one in. Just like so, just nice and easy right along there. Spread it a little bit wider. Thank you. To the thumb. And then you have this really nice lift all the way around. Just one more. Okay, so we'll make that a little bit wider. The whole thing, and then you get movement on all of the tissue all the way around. This one you can take it right here. Thank you. Bring that to the middle. And this one could come around if we needed a little bit more right there. We can put one there. We can use our skinny piece right here. Like multiple pieces. Just want to get the lift to go everywhere around that location. And so every time you move, nothing is sticking on any bony prominence. Get right there. Piss it off. There we go. Just like this. Okay. There you go. So every time you move around, everything should lift and move, and nothing should be really sticking to those bony prominences. Very nice. Thank you, model.